Barrett's esophagus occurs when acid from your stomach comes up through the sphincter muscle or valve and hits your esophagus cells or lining constantly over a period of time. The sphincter valve over time becomes weak and doesn't close as tightly as it should, and this allows the acid to constantly come up and hit the lining of your esophagus. Barrett's esophagus is a link that starts when you experience heartburn on occasion. This will progress to acid reflux and then to GERD, gastroesophageal reflux disease, then possibly to Barrett's esophagus, and in some cases to esophageal cancer. With this history of heartburn and acid reflux, a gastroenterologist may decide to do an endoscope to check to see if abnormal cells appear. When they are biopsied, they can be diagnosed as low-grade or high-grade dysplasia. If they are low-grade, they will probably bring you back for periodic endoscopic exams to check on the progression of these cells. They will work with you in developing a diet, possibly losing some weight, to avoid acid reflux where possible. If they are high-grade dysplasia, then there are certain endoscopic options that they have available to them. The options are endoscopic mucosal resection, in which they will shave off the abnormal cells; radiofrequency ablation, in which they will use a burst of radio waves through a special device to burn off the abnormal cells; cryoablation is where they use a cold liquid and gas to freeze off those abnormal cells; and the last is photodynamic therapy, in which they use light-sensitive drug and lasers to destroy the abnormal cells. If the Barrett cells are very close and to the lining of your esophagus, these procedures may be deemed too risky to fear they will make a hole in your esophagus, at which time they will decide to do a full esophagectomy surgery. If you have heartburn or persistent acid reflux, seeing a doctor and treating this early can save you going through a Barrett's esophagus procedure. We have a series of articles about Barrett's esophagus on our website, www.fightec.org. Take a look. Thank you and take care.